Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all across the country. And today we're going to be talking about one of those super hot subjects, which is how do we create a balanced practice and a balanced life with one of the best educators in all of dentistry, my friend Drew Cobb from the Dawson Academy. So you do not want to miss this. Grab a pen and hit the share button. We'll see you in a second. Hey guys, welcome back to the Best Practices Show. Thank you so much for watching. This is so much fun to get all your feedback and again, just kind of bring you the stuff that you guys are asking about. And today is no exception. One of the hot topics in great restorative dentistry is how do we create this balance? Because you know as well as I do, going down this path, it can be a dangerous path where you get overly committed. And you can also become quite weary sometimes. And I've got the guy who's going to get us back on the path. Now, a couple things before we get rolling here. We are shooting this live on Facebook. So as you're watching this, if you're watching this during the live broadcast, feel free to add questions to the feed. And I'll ask Drew directly while we got him on here. And then if you're watching it later on, don't hesitate to ask a question later on in the feed, and we'll get you the right answer, because we want you to walk away from all of these with the right solutions and the right answers and the right insight that you need. So my guest today, I'm really pumped about this because not only do I really admire him, he's an incredible educator, but then what he's all about and the part of the organization that he's all about. I'll give you my intro. And I've heard his name for years and years and years. I'm like, and all of these dentists would be going through the Dawson Academy like, oh, I love Drew. And Drew is just a very, very cool guy and a lot. He's got an incredible story that we're going to talk about in a second. But he is the core curriculum director for the Dawson Academy and senior faculty. And I had a chance to be with you, Drew, a couple of weeks ago at the Dawson Alumni Academy, and that was so much fun. I was telling you before this, it's nerve-wracking to speak to you guys. I can speak to strangers, but you guys are like the cream of the crop. So I was just grateful to have the opportunity to be with you guys, and so it's so much fun. So Drew, if people don't know you, can you let them know who's Drew Cobb?
Yeah, so thanks for having me here, first of all, Kirk, and thanks for coming to our alumni meeting and speaking. It was great. I can't imagine you having a tough time talking to anybody. But
I don't know. You guys are an awesome group. So yeah,
it was great having you there. So kind of, how did I get here? I wonder that somewhere. How the heck did this happen? So years ago, I was really fortunate, going through dental school. My dad was a dentist. He was a full-time faculty at Georgetown's dental school, and he had a full-time practice. So I went through Georgetown. My day one, I had my dad as one of my instructors, which was kind of an interesting experience. So when I got out of school, though, I practiced with Dad. And I practiced the way I was taught at Georgetown. And it was great. I was really lucky. I was busy. Things were great. I was booked a couple months in advance. But, it was full of kind of reactive dentistry. Patients would have a problem. I would kind of fill it. So I got to this point. I'd been practicing for a number of years now, 7-10 years. And I couldn't practice any harder. I couldn't shove more patients into my schedule. I couldn't work any longer. I was working 5 days a week and some Saturdays. The stress level was high. After a while, your production kind of bottoms out. I couldn't see the other side. And honestly, I was almost 35 years old, and I was getting burnt out. And I love dentistry. I mean, I had grown up in dentistry. My dad was a dentist. I have very close friends who I called uncles who were dentists, and I had seen this as like this great career. Yeah. And so I was burning out. And I kind of, the thing that got me one time is that the one that was my paradigm shift was I had a woman that came in. She was referred by another patient, perfect way to get patients. Mm-hmm. So a woman came in, and I took her through my examination at the time, which I thought was pretty thorough. It was about half an hour. Same way I've been taught in dental school. And you go through, this tooth has this, and it needs X, but you're not connecting the dots together. So as I looked at her, The longer I looked at her, the more I realized as I'm doing my exam that I had no idea how to solve her problems. Because it wasn't bacteria-based. It wasn't decay. It wasn't gum disease. Her teeth were wearing out. She was 35 years old. She was coming to me because she wanted to look better. Mm-hmm. And I had no idea how to help her. I ended up referring her to a prosthodontist, a faculty member of mine when I was at Georgetown. It was the right thing to do. But I got to tell you, it rattled me. And I went home that night and I kind of looked at myself in the mirror and I had a heart-to-heart with myself. And it's like, Drew, either you got to find another career or you got to get a lot better at this. Mm-hmm. Fortunately, at Georgetown, Pete used to come up and give some presentations. So I had his book. I was like, you know what? I'm going to go listen to Pete before he retires. Now, of course, that's like 25 years ago. Pete's still practicing. You know, it's unbelievable. But that first lecture, when I heard a different way than I was taught in dental school to practice dentistry, that light bulb went off. And I was like, I was all in. I was going to do anything I could to practice that way. And it changed my life. I mean, it changed my life as a dentist. It changed my life as a person. And that's not really why I went. But as I kind of got my act together with my practice, I wasn't in my practice all the time. That I could have a life outside of it. You know, my son was young at the time, and it gave me an opportunity to not just be a dentist, but to be a dad. Yeah. You know, so you know, I was the dad on field trips. I did hot lunch. You know, I coached little league, things that my son still talks about because you only get one shot at that. Yeah. You know, dentistry is really important, and I love it. My passion is back in dentistry. So since I went through the Dawson Academy. But, you know, with what's the important thing? You know, at the end of the line here, are we going to be talking about what a great practice we had or these great patients? And I probably will a little bit because I really love that and get, you know, psyched for that. But I would remember the times that, you know, I coached Little League or did a special trip with my son or, you know, that's what you got to remember. Yeah. So getting your life in order in your practice is paramount to getting your life together. And that's probably the greatest gift I got from Pete Dawson. And not the reason I went. I was trying to be a better dentist. Hands down, it did that. But by getting my life in order, I was actually able to have a life outside of dentistry. And I think that's the key. You know, there's lots going on in dentistry. There's lots of ways to practice. But this isn't about getting buried in your office from 8 in the morning to 8 at night and you're trying to get better, but you're not getting there, and you really get frustrated. And the last thing you want to do is to have your practice taking you away from your family and other important things that are going on. So
absolutely. Yeah. Yeah, and I'm going to ask you this too because now why is this such an important topic now more than ever? Because you train dentists from all over the world. You guys are now in India, you're in Japan. I mean, you're getting not just the United States dentists, you're getting dentists from all over the world that want to get better. And you look in their eyes at that first seminar and you can see the stress. Why is this a hot topic, having that balance thing?
I think it's just, I don't know, I guess it's the way that dentistry has been taught. You know, we kind of been taught this tooth by tooth dentistry, and it is a totally different practice model. And the only way you get to a point, I think, that you're productive enough is you just got to you got to have more procedures, you know, and there's only so many hours in the day. There's only so many patients you can put in there. Right. You can only have so many patients running through 2 or 3 or 4 hygienists in a day that you're responsible to, and then you're trying to do your dentistry. Yeah. I think it just really ups the stress level. And I think, you know, across the world, you mentioned that, it's like wherever we've gone, it seems like a similar thread. And I also think secondarily, and maybe the main reason, is that I think most dentists figure out that there's got to be a better way to do it. And I think intuitively you realize that even though we're doing our best, there's probably a better way to deliver better long-term care and solutions to our patients. And it's not an insurance-driven thing, because that's not what insurance is cares about, you know?
Yeah, absolutely.
Yeah.
And it might be, you know, I'm going to use the cliche that everybody uses, but it's true. You know, you've heard this for years. When the student is ready, the teacher appears. How much of that played into it for you, Drew, at 35? Do you have to be a little fried to say, you know, because I know when I was younger, no one could talk to me. I had it all figured out. But then do you have to be a little tired to say, look, there's another way, you think, now more than ever, or not?
Yeah, you know, it obviously it took me to kind of get to almost a breaking point. because I'm pretty hard-headed. What I love now, though, is how many young doctors we have going through our programs. And I always tell them, you are so much smarter than I was. Like, you figured this out after just being in practice a year or two, that there's a better way. Right. And sometimes for a lot of them, they might have come across somebody who's a mentor, somebody they respect, somebody who they've looked up to, or somebody who's taken the time to say, you know what, this is a great profession, and there are better ways to do it. And you know, and they've kind of driven them through our programs. You know, Pete has said for years, and the first time I heard it, I didn't listen. Takes me a couple times sometimes for it to sink in and for me to realize what it is. But Pete has said for years that dentistry is the best hobby out there. Yeah. I was too burnt out to think of it as anything like that. But you know what it is now? I just had a great morning of my hobby here today. It was fantastic. I had a great day. Yeah. And now I get to talk to you for a little while. What a great day.
It's awesome.
Sunday too, man.
Absolutely. Maybe not for your generation, but the next generation would say, well, we got an expensive hobby here, you know, type of a thing. So you do need to make it a good business. And, you know, when you talk about the balance, you know, the 8 to 8 thing, you know, walk us through some of the process, because you're now fee for service. And now that was not easy. No. I want to really just go right there, because some people think, well, that's just Drew and he's in DC and he just snapped his fingers and went fee for service. It's not that easy, right? Yeah. Yeah. No, it's hard. Even though I was fee for service, I was really, really lucky because my dad was always fee for service. So I was just always able to start that way. But, you know, even if you're insurance driven now or whatever it is, it's still the same. I think what you're looking for is, the big thing here is that it's not necessarily for everybody, but it's figuring out and identifying the patients that need a different approach to get healthy for the long term. Honestly, I think it's as simple as that. Yeah. And so our approach is all about how you identify those people. You know, what are you going to do? Yeah. You know, sometimes it's obvious, but you know, it's not everybody that's just walking into your office because they want veneers and they want to look better, or their dentition is breaking down. Because my gosh, if we can identify some of these patients earlier on, before things get really bad, wow, and we can do something to affect their long-term dental health. What a great thing. What a great service. And I think that's one of the keys. Yeah, absolutely. And so, you know, if you're a younger dentist watching this, maybe 32, you could say, hey, Drew, where do I start with that? Because right now I've got a lot of people coming in from Delta, Cigna. You know, I've got my fee for service. Yeah. I get that, because not everybody is people that I want. And what you find is that your favorite patients share the same core values. So what were some of the things that you've done to kind of focus on the people that you feel are a different approach? Actually, you know, I think probably the first most important thing was I had to wrap my head around it and figure out how it was that I wanted to practice dentistry. And that's one of the great things, you know, in dentistry, we're still, for the most part, our boss. Right. So we can still figure out how do you want to run your office? Yeah. And don't start this on a Monday morning when things are a mess. Sit down when you have some quiet time and figure out, how do I want to live my life? How do I want my practice to be? And you kind of work backwards. So here's one of the big things, though, is I had to be committed to kind of the process that I learned from the Dawson Academy. You know, that was number one. And I think the driving part of that is you just had to block out time to place patients so you could do a more thorough exam. Everything starts at the examination. You know, I mean, you know, Pete talks about it. It's almost like you're giving the patient a physical for the masticatory system. Right. So it's not what I learned in dental school. It's not just going through the chart and tooth number 2 has X and it needs Y. Mm-hmm. That's part of it. But it's those teeth fit into a system, and how is the system working? And you're trying to identify, if it works for that patient, great. But if it's not working, it's more than just fixing the teeth that's going to be the long-term solution. So number one was just finding the time to do the exams. And doing the exams on people who are ready to hear it. Yeah. Now, can you just clarify this? Because I know, but some people might say, okay, well, you say comprehensive exam. I mean, I'm just, you know, if I'm fresh out of dental school, it is 30 minutes for me. Like, and then is it a 3-hour deal? Do you do it? What would you consider a comprehensive exam that you would define straight from the top of the Dawson Academy? So a complete exam basically is adding on to what you're already doing. So it's not like you're just blowing up everything you've already done. Keep doing what you're doing. You're still going to do the bacterial assessment. You know, you are going to chart the teeth. You are going to look for the bacteria-based issues, decay and perio disease and endo issues and that sort of thing.
what we're really doing is we're adding on to it. We're adding on the functional piece and trying to identify, does that work for the patient or not? So you're kind of adding on this TMJ occlusal examination, which is basically looking at the function.
Right.
And that's what you're at. And that's not, so my exam takes an hour. It's not a 2-hour process. It's an hour process where we're adding on a few layers to what most dentists are already doing.
Right. Right. And you guys taught me this, in that hour, one of the dangers you can have as a great restorative dentist, you can get really focused on the information, and it's deeper than that. I mean, you're making a connection with a person and building a patient base.
Absolutely.
And that's really a big part of your patient selection, because you're in DC, right?
Yeah.
And you're looking for a discriminating patient, aren't you? Somebody that really cares about their health.
Absolutely.
Right?
Absolutely.
Yeah.
So, we talk about, again, one of the things so many of the things I've learned from Pete is, in a certain regard, you're trying to separate yourself from everybody out there. We've had this term for a number of years that we want you to be the go-to dentist in your area. We want you to be known as that dentist that can solve problems that others can't. Right. We want you to be able to maybe do things a little bit differently. And it's amazing. Your patients notice this. Here's a number one thing I hear after I've done an examination on patients. You know what? Thank you so much. Right. Nobody has ever spent that much time and been so thorough. I really appreciate it. That's probably, and we hear that from our students that start to implement these processes. Again, it's not about trying to sell things or find dentistry that's not there. It's really just trying to identify, does this patient have issues that we can solve? I mean, it's that simple, and the exam drives it. Right. Another big one I think that's super important that Pete again has talked about. I keep going back to Pete because our foundation, everything runs through Pete. But he always talked about when you do the exam about it being this co-diagnostic process. And what we mean by that is it's not you just going through this checklist of information, although we do have a checklist, and I think that's really important. Mm-hmm. But it's while you're going through things, you're explaining to the patient what you're doing and why. Mm-hmm. And you're talking about signs and implications. Here's what I noticed. These second molars, they're really worn down, and those are the teeth you said you're having sensitivity with. Has anyone talked to you about why they're worn down and what we can do about it? And here's my worry if we don't do something. So, treatment planning starts in the examination. And if you don't start the treatment planning in the examination, if you end up at the treatment plan and you just try to drop this big treatment plan on somebody, it could be the exact right thing to do, you're not going to get there. Yeah. As you're doing this co-diagnostic process, basically what happens is your patients want solutions. They want to fix things. Will you help me? And then that's kind of our next step through the process of complete examination or complete dentistry as we talk about it.
Yeah. And then I just want to ask you a little bit more just about the co-diagnosis, because while it's a term people hear, I mean, really what you're doing is you're involving the patient in the whole entire thing. It's not a one-way communication where you're just verbalizing, because that can be in danger too. You learn a lot about dentistry. You're so quick to tell everybody the pathologies, some of the patterns you're seeing, and you want to go slow enough where the patient can talk, right?
Oh, absolutely. Oh, no, listen, we are all at fault with that. And, I had this point for a while. I did Dawson and then, I hate to talk like this because I feel so old sometimes when I say this, but it was all about function then. Right. And then that aesthetic wave started. Mm-hmm. And in some regards, I think Pete Dawson was actually the forefather of aesthetic dentistry. He just didn't know it. He talked about exactly where front teeth should go in relation to function for a patient, how the lingual contour should go, where the incisal edge should be. Mm-hmm. But with the aesthetic wave, what happened to me is okay, I get that now. I just need to now learn how to make it pretty. So I went through a program down at LSU. They had a fantastic, at the time, aesthetic continuum. Just Jimmy Eubanks and Jeff Morley and just some great people down there. And then I kind of put that into play. But I got to this point that I'm really smart now, aren't I? I've done Dawson. And
those are some heroes. Yeah.
And the more I went through, the more information I had, the harder it was for me to figure out what to do, because there was so much stuff I saw now, but I didn't know how to put it all together. And again, that's where I think some of our treatment planning processes just kind of simplify things a little bit. Here's the stuff we have to focus on for function. Here's the stuff we have to think about for aesthetics. And now we can blend it all together. But again, it starts at the examination and identifying problems and diagnosing it. Then we can talk about treatment.
Right. Because when you slow the process down like this, can you speak to this? What you find is the byproduct. Pete used to say this all the time, making money in dentistry isn't very difficult. It's just do the right thing and the money will follow. What you find is when you go slower, because everybody knows this, if you're watching this, you probably have a practice of dentistry within your practice that's never been discussed, never been diagnosed. And we find diagnosis is so low across the board in the entire country that when you go slow, you just find that the result is you're going to end up producing more per patient, which goes back to your whole premise for this is balanced practice, balanced life. You don't need to see 40 new patients in a month, do you?
No, not at all. In fact, that's so key. Pete has talked about for years, and listen, this is how I've done things since I finally kind of figured out how to do this. He talks about all you need to do this, and you'll be busier than you can imagine, is 12 to 15 new patients a month.
Right.
And that is so different than what most doctors are hearing nowadays. Like you need programs and you need social media and you need 30 to 50 new patients. 12 to 15 new patients, and you're going to have more dentistry than you can do. Right. And I've been living proof of that. And the other thing that Pete had said, which is really, really true, is of those 12 to 15, a lot of them are already in your practice. Right. And what I mean by that is that, you've been practicing a certain way for a long time. And I know, I have a high respect for dentists. I really think we work hard. I think the majority of dentists are out there really trying to do the best they can for their patients. And they're doing a really good job. But some of our patients, then again, need this different pathway. So if you simply identify some of the patients who are already in your practice, they know and love you already. But if you can just slow down and have a conversation with them, all of a sudden they're one of those patients that you can now just do this complete examination for. So, and it's not apologizing for stuff we didn't know or anything else like that. And it's kind of I think sometimes a simple conversation, because I went through this, So at first, as I learned more about Pete, I was like, well, now what do I do with all the patients that have trusted me for all these years? Right. Do I have to tell them I really didn't know what I was doing? Now I'm a lot smarter. Let
me ask you that question because there are people in the middle of that transition. How did you handle that? And what did you say?
I think honesty. And it was as simple as this. Just so a lot of them are in hygiene, right? Because we're basically taught to treatment plan out of hygiene. And your hygienists are taught that they have to schedule X for our practices to be productive. So I would just through hygiene, one was me taking the time to do it and maybe teaching my hygienists a little bit some of these concepts because they can build as they're doing their appointment. But, I would just go and say, Mr. and Mrs. Jones, thank you so much for being a patient for all these years. I really, really appreciate it, But here's what I say. There's some things I see that I'm a little worried about. Changes that are happening over time. You know what? It's been a long time since we've done a thorough exam. What I'd love to do, let me bring you back another day when I have more time. We can spend some time together. Let me do a new exam, update our records. And we can chat for that, figure out what's the best thing we can do for your long-term health. How's that sound?
Yeah.
They already know you and love you, Kirk. So I don't think I ever had anybody say no.
Yeah.
And you don't have to try to convert your 2,000 patients all in one day.
Right.
As they come in, take the ones that are worse, and the ones that want you to solve their problems. Because you talk about treatment planning and acceptance. And so if you do it this way, I have a very high treatment planning acceptance. And it's not because I do anything great. It's that I'm only treatment planning those that want me to solve their problems. Otherwise, I'm not going to do it.
Right.
It doesn't mean I'm not going to help them. I'm still going to take care of their bacteriological issues, decay, perio, usual, reasonable, customary, all that sort of stuff. But I'm not going to take the people through this, complete process of getting the exam, the photos and the models and going through the treatment planning if they don't want me to.
Right. And that's a really important point you're bringing up because that's where it can wear on you. So what you're saying is basically, would this be done in the morning huddle or would it just be kind of just kind of almost cherry picking the schedule and having the conversations intentionally with the people that are the best candidates for this? Is that how you would do it on a daily basis?
Absolutely. Absolutely. So A morning huddle's great because when you go throughout the hygiene, you can identify some people that have maybe putting things off. I mean, great time to talk about patients then.
Right.
We do an afternoon huddle and a morning huddle.
Really? So what time is the morning huddle? Just because I want to get inside your brain.
Yeah, that's right. So I start early. So as again, remember I say I was practicing 6 days a week for a while. Right. Now I practice 4 days. I practice 7 to 2, 4 days a week, Monday through Thursday. No lunch or anything else. We work straight through. 2:00 we're done. 2:30 we're done. So after that we have a morning huddle or an afternoon huddle where we go through the day. Is this patient set up? Did we get the referral in for X, Y, and Z? Do we need to do anything here? But it also, the reason I did the afternoon huddle too is then we also preview the next day.
Okay.
So as you start to do this kind of dentistry with a block schedule, I block out a couple hours each morning that we call primary care. That's where I can do my complete dentistry. Because those patients generally need more time. You're doing multiple restorate, whatever it is. You're doing longer blocks. But I get to review for the next day, are we set for Mrs. Jones? Do we have the prep reduction guides? Is the wax up here? So because I found at one time, all it took was one time, at the morning huddle, we didn't have that stuff. Mm-hmm. But the patient was coming in. We didn't have a chance to save.
Right.
But if I pick it up the day before, we can save. And here's what will happen. Whatever staff member is responsible for that now has to stay late to get it ready one time. It'll happen one time, and then that staff member will never forget again.
Oh, nobody wants to stay after everyone's gone because you got to do everything else that nobody else did, right?
Yeah. I'm the only one that stays after now, but I'm working on Dawson stuff or whatever else. But that's all good.
This is awesome. So 7 to 2, 4 days a week. And as you can imagine, if you're listening to this, so the whole big thing with, balanced practice, balanced life, I mean, you've got a whole day after your day is done. That's the first thing I'm looking at, right?
Yeah, exactly. So, and that's where, so when I was able to shift my schedule like that, 2:00, I could pick my, at the time, I could pick my son up at school. I could, I coached Little League, baseball, basketball. I had time to do that stuff. Right. When I was in high school, my son was a lacrosse player. I made the games, so, and that was fantastic. And it wasn't that I needed to cancel an afternoon of patients to go do it. Right. It was, but I sat down and I thought about what do I want my life as a dentist to be? And then I tried to make it happen. And I get lucky, but there's a lot of hard work in there too. I mean, I don't want to sit here and tell you that you just snap your fingers and instantaneously this happens. You and I were talking earlier, Kirk, and I'll be honest, I have made every mistake you can make from trying to go from what I will say is the maintenance practice that I was taught in school to this more complete care practice.
Yeah.
And I think one of the things that we've really tried to do at the Dawson Academy now is as Glenn DuPont, if any of you know Glenn is fantastic. He was, one of Pete's partners and one of my instructors and one of my mentors. Yep. But he used to say, we've done the research on this, which means we've made the mistake. And then if you can learn from our mistakes to avoid some of this, and we can streamline the process and help your success be quicker and easier without some of the headaches we've had, that's what we're here for.
Right. And to make a mistake one time is okay, but to repeat the mistake is stupidity. And, I mean, when you're listening to you, Drew, I mean, 7 to 2, think about the change in thinking that you had and how many more days of your life that were just freed up just with that practice model in place. And, being in DC too, people can come in early before they get started. Yeah. They still, your patients have the same concerns that every other dental patient has. They don't want to miss work, right?
Yeah,
so,
correct.
So you guys can start fresh and early and go. And
Yeah.
Now, a couple other things. I'm taking notes here as we're talking, because when you talk about 12 to 15 patients a day, like Pete said, I mean, you can think about this. If you're a dentist, you're talking about, if you practice 13, 14, 15 days a month, that's about one new patient per day, right?
Yeah.
And you're doing about one comprehensive exam per day. You're not doing 9 per day.
Correct.
And then
absolutely.
And I've heard this from you guys. As a restorative dentist, you don't want to be managing 30 cases anyway. And when it's true complex restorative, you only want to be managing 5, 6, 7 cases at a time. You know what I mean? Is that true?
Listen, if you have, like what you just said, if you have 5 to 7, you're a consultant. Do the numbers.
Right.
You got to smoke and practice. You're doing great. You're doing great. There's plenty there for all of us.
Right.
So yeah, you're busier than you need to be.
And you don't need 32 ops.
Oh my God, no. I've got 4 operatories. Now it's just me. Since my dad retired and then passed away, it's just me. I've actually, what I've had in the past is I've just had another dentist who sublets from me.
Really? Okay.
So, because and it was a friend from Georgetown, and he had, had something happen with his practice. But so when I leave at 2, he would come in at 2:30 and practice until 5 or 6 in the evening. Practice all day on Saturday, and he'd do a little bit on Saturday. So,
wow. Can you talk about this? Because I love that. Now, the thing that keeps people from doing this, maybe going to the Dawson Academy or creating a balanced practice, is a lot of the fear. I mean, I see it. People are just afraid. They're afraid that their patients won't pay. They're afraid that they. Can you just talk to that?
Yeah. I think any post-grad education, there's a fear factor. Is it worth it? Is it worth the money I'm going to spend? Listen, we get it. You're paying money for a course. You're going to be out of your office for a couple days. You're going to pay to travel. You're going to be away from your loved ones. I mean, it's a big commitment. Mm-hmm. But again, I think you just have to sit down and think within yourself, what do I want my life to be?
Right.
Because it's not going to happen without some work. You got to put something in. You got to get the knowledge. And then you got to put it in. And then the knowledge isn't enough. You got to put it into play.
Right.
I think over the years, I'm sure people that lots of doctors that have maybe gone through and they're incredibly smart. They got all of this down. But honestly, you know what? If you don't implement it and you don't change your life as a dentist, if you don't change your life for your patients, it's just a great intellectual exercise. But what we want is we want to change your life as a doctor. We want to change your patients' lives. So you got to put it into practice. And that's, I think, really what we try to do. And I think that's one of the big things with the hands-on courses, because that's really the hands-on is, I think, really where you learn it. So concepts are great. We have the seminars, John and Pete, and, they're still there. You get the concept. But until you actually get to learn the techniques, that's the one that's going to affect change, I think, in your lives.
Right. And then you use the words, put it into play and bring this back. Some of the dangers about getting exposed to such great information is you come back, you're pretty motivated. And now you have all these people that you're looking at in your practice that are your team. Yeah. And sometimes they're going to resist, not because they don't want to, they just So can you speak to that too? Because you're going to have resistance everywhere, not only up here, but in front of you.
Yeah, no, there's a lot. And I could talk for hours about that one, because again, I've made all the mistakes.
Right.
So I remember as I sat in that first lecture with Pete, one of the things I saw, he had this block schedule, which was new. Mm-hmm. And I was booked 3 months in advance, but with all these half-hour and hour procedures, and I didn't have anywhere to put somebody if they wanted me to do complete care. Right. But I saw Pete's schedule, and I thought, and that was how Pete also, that balanced practice, balanced life. And I was like, oh God, I want that. I want that so badly. So and Pete color codes everything. And this is where he did his exams. That was a certain color. Here's where he did his restorative. That was a certain color. Mm-hmm. So I remember that night after that lecture, I went to the store, I bought some paper, and I bought some colored pencils. And I designed that night, probably had about a glass of wine or two. I designed my perfect schedule. It was a kaleidoscope of colors. And I came back to my office that Monday morning after that course, and I put it on the table and said, here's our new schedule. Almost everybody quit that day.
You mean they didn't jump up and go, yeah, that's awesome?
Yeah, no, they didn't do that. And I was like, how come they're not jumping up saying this is awesome? So it took a while, but I had to show them what I learned, and I had to bring them on board. And until I did, they weren't with me. They were against me. And so this is, as you said, this is very, very much a team effort. Right. And you can't do this kind of dentistry without your team being on board. Now, I will say a lot of them, when they're exposed to the information, they're like, oh, this is great. Wow, if we could work this way and do it this way, fantastic. But you probably will come across staff members who are comfortable. They're set in their ways. They don't want to learn anything new. And I know I made the mistake of probably holding on to some of those employees too long, thought that I could coach anybody up. And finally, I had to change some staff. And probably every time I changed the staff afterwards, when I thought about it, I just should have done it a lot earlier.
Yeah.
So
absolutely. Now, and one of the things I love the way you guys teach, and I want you to just speak about this because changing your practice to incorporate new things, it isn't often bringing the new ideas back that is the problem. It's getting the old ones out. And you guys at the Dawson Academy make people pick behaviors they're going to start and then behaviors they're going to stop. And why is that so important? Because this isn't about implementing. I mean, there's some things that we do that we just need to stop doing, right?
I know. Well, yeah. And if you really sit down and think about it, those aren't that hard to identify. You just have to stop long enough to think about things. Yeah, I think sometimes we just got to get outside of ourselves. You know, dentistry sometimes can be very insular. You know, as great as it is that we're our own boss, sometimes we're our own boss with no one looking over our shoulder either. There's no one there to say, hey, you know, this doesn't make any sense. Mm-hmm. So, but when you back away from yourself a little bit and get your head out of it sometimes and look from the outside in, you say, wow, if I just, you know, here are a couple things we just don't need to do anymore. Right. But the thing about adding things that you want to change is, again, you're not going to get to change unless you figure out what you want to change and then make the change happen. Mm-hmm. So, and you're right, it's not that hard. You know, a lot of these concepts, when people learn them, it's like, it's not rocket science,
right?
But it just makes perfect sense. And the technology stuff, man, they are throwing so much technology at dentists now, and it's cool. And I think dentists, we love technology, you know. I mean, I remember when I was out of school court, everything new I wanted was like $1,000.
Oh, yeah.
And then it was like $10,000. Now it's like everything you want is like multiples of, like the game is ramping up now, you know. So technology is great. But sometimes technology is just technology. It's cool. But is it really helping us what we do better? I think the way we kind of look at technology a little bit, you got to have some kind of foundation. And then when you have the foundation, you can add technology on top of it if it's going to help you do that better and get a better result in the end. And then you can sit back and say, does it make sense to spend that amount of money? Because I think some doctors now are like, we're just buying all this stuff because we think it's going to get us to the next place.
Right.
And it's just another expensive toy that maybe doesn't have the benefits we thought it was going to have.
Right. And could you speak to that too? Because our generation will be one of the few that probably remembers what it was like before the technology and after. And I've heard so many great restorative dentists say the importance of understanding these concepts analog before you go completely digital is key. Yeah. You know, my son is diabetic, and we wanted to find you go to the pump, and they're like, no, you have to learn how to do this without it because technology fails, so that you have a better appreciation. Right. And in dentistry, wouldn't you agree? You need both because the technology is just not going to do this and make your practice all that great and have a balanced life, right? It can complicate it sometimes when you go in that direction.
Oh, absolutely. It can make it a lot worse, actually. What you think is going to make it simpler, it can make it a lot worse. And I totally agree. You know, I think for anything, you got to have a foundation of knowledge to build off of. Right. And a lot of things we do now, Kirk, you know, spot on, is we're still some things in the analog world and we're switching to the digital world. I mean, I think this is one of the great transitions all of us are going to go through over the next 5-10 years. I mean, simple things like models and impression, you know, that sort of thing. We're already scanning and everything else. You know, but for us, I think one of the big shifts is, you know, we don't just take the models, but we mount them on an articulator to mimic how function happens so we can study it better. We take a face bow so we can better relate the setup on the articulator to be closer to what's really happening in that patient's mouth. We start our occlusal analysis from centric relations, so we take a centric relation record. So, you know, you're used to those Dawson doctors having all that together on this apparatus. That thing's going to be a dinosaur here before too long. The transition, though, is if you don't understand that, and if we could do it digitally, you don't understand the importance or how we can do it digitally. So we can already scan the models, but it's kind of marrying those things to however we're going to do it. CT scans, virtual articulators, like some of those things are out there, but we don't quite have all the concepts together yet. But you got to understand what you're trying to do before you can get to that. And then, you know, imagine, because I think about this a little bit. I've had some relationships with some of the young doctors, young dentists that are still in school. And some of them, they're only learning to scan models now. Like they don't know how to take impressions. But what are they going to do if the scanner breaks?
I guess they just shut down for a day, right?
I know. So, it's quality. You got to be able to start with quality somehow. So a lot of those things are changing. But again, you need that foundation before you can move on.
Yeah, and can you speak to this too? Because one of my favorite things, this was more than 20 years ago, I asked Pete at the end of the Top 10 seminar, I go, Pete, if there's one thing you could say for sure, what is it? And he goes, He said, I would say this, don't ever stop learning. Would you say, even at your phase, are you just totally there? Have you reached the pinnacle and are you just good? Or does the learning process always continue? I know how you're going to answer this, but I want you to speak to that too, because I watch the fire in all of your eyes. You guys are having more fun than you've ever had, but you never say, I've got it all figured out, right?
You know what? You never get it all figured out. I think the minute that you realize that and you're okay with it, then it doesn't matter. Right. Because that paradigm shift I talked about, I went through dental school. I did some continuing ed stuff. I thought I was pretty smart. I did well in dental school. It's almost like I had ended my learning for a while, and it was all me. And it took a lot for me there's a plateau. The only way you're going to grow is to keep increasing your knowledge and to be open to the knowledge. And that allows you to be open to not necessarily criticism, but new techniques and people helping you with those techniques to put them into play. And unless you open your mind to knowledge, you're not going to go anywhere. And this is a fluid thing. It is always changing. I was in at the American Equilibration Society meeting in February. And so fabulous meeting, really, really smart people, research, latest stuff going on with airway and temporomandibular joints and function, all that sort of. Sitting right next to me for those 2 days, taking notes was Pete Dawson.
87, right?
Yeah. Unbelievable. He's sitting there taking notes. And if that's not enough to inspire you, nothing will. Nothing will. Right. But it makes life interesting too. I don't think one of the things too that my office has learned too, the minute that we think we have something down, because there's a lot of repetition in dentistry. And that's important. I think, that repetition helps us be good. But the minute we think we have something done, they know I'm going to change something sooner or later. If I see something that's going to make it better, easier, whatever, we're going to do it. So they know not to get stuck in their ways too much. Right. But it keeps life fun too.
Yeah. So I can tell my team, they think I'm crazy on Mondays. They're like, oh gosh, here he comes. He went to a course, and if they can just keep me calm for the next 2 days, I'm almost back to normal. But
exactly.
So that's great. Now I want you to talk about, this weekend you had a couple students. I want you to talk about that. So you had 4 dental students with you, this weekend. Yeah. Talk about that, because this is important. And you think about these students, the opportunity for them at such a young age to see a balanced practice and a balanced life. Yeah.
So it's really cool. So one of the things we've done at Dawson Academy, we started a couple of years ago, is we've started regional study clubs. Okay. And the whole reason for the study clubs was to make it easier for the doctors going through our programs to implement. Mm-hmm. It's not new information. It's just you're together as a smaller group. We get to review things, and we're trying to help you more to actually put what you've learned, into play. And tremendous benefits I've seen for the doctors that have gone through this. But what I did this year is I'm kind of fortunate. My oldest son, his best friend, worked for me for a couple of years. He wasn't your medicine, dentistry, whatever else. He kind of worked in my office for a while, decided on dentistry, and he's in his second year at University of Maryland. Mm-hmm. But what I told him this year, I said, listen, you find a couple of your friends that are interested in really being the best dentist they can be. And you all come down. You can sit in on my study clubs for free. You just come down. I want you to soak in the knowledge. And so they've been doing this for this year. Every one of them came up to me Saturday. We just had our last meeting for this year. Every one of them came up to me. How can I become a Dawson dentist? They don't teach us this stuff in school. This makes so much sense. They're starting clinic in a couple of weeks. And they said, we're starting clinic. I have no idea how to treatment plan. Yeah. But they've seen, not just me, but they've seen all the doctors who've come through our program now on how they do the evaluation. They find out what the problems are, and then they treatment plan in this programmed approach. I think they're way ahead of the curve. Right. But it was so cool, though, that the light went off. And I said, here's the deal, though. you can't say anything. You got to go through dental school and just listen to what your instructors tell you.
Right.
Get that foundation because they got your best interest in mind. They can't teach you everything, all at once. And then if you still want to go that way, then you're going to add that layer on. Go to the Dawson Academy.
Absolutely. And I'm
Yeah,
guessing
cool.
you got a bigger high out of that than they probably did just because you're giving back.
That was great. Yeah. They're going to take me out to dinner too. So I get that going for me.
That's awesome. And I really think, honestly, this is one of the things that's missing so much from this great profession is you can remember this word. It was preceptorships. We used to have those and it was a responsibility. It wasn't like a convenience. It was part of making sure that these kids all came up with the right tools, the right thinking, and they could call on you. And I remember dentists used to say, hey, come over to my office on Thursday afternoon or Friday. And for nothing, we'd hang out, they'd order in sandwiches and say, don't do this. I've done this before. This is and we just don't have that anymore.
Right. I think, because you're right. I had that, because I knew so many of my dad's buddies and everything else. They're great. I had so many fantastic people take me under their wing. But I do think, one of the things I like about the Dawson Academy and the faculty and the TAs and everybody associated with it is, it's kind of an open door a little bit. I have people rotating through my office all the time that come in for a couple hours and hang out. And we mean this as they go through course. If you have a problem, call us, So anything we can do to kind of help them through the process, we try to do.
Yeah, absolutely. Now, any other things that you would say, if I'm a young dentist watching this and I want to balance practice and balance life, what are some of the other things that you'd say are really important keys for a long-term, very healthy thought process about your future in dentistry?
I am going to kind of start at that beginning again. Like, what do you want your life to be and work backwards? Now, for a lot of the younger dentists, if you're already in this practice that's, whether it's insurance-based, corporate, or whatever else, this stuff can still work in there. And I think what's important is we don't want you to think that you're going to go in Monday and all of a sudden cancel every insurance policy you have or quit this and blow up your practice. Right. Don't do that because you're making a living, you're paying the bills, you're probably doing okay. Mm-hmm. So what we want you to do is to kind of add on to that some. And so you do some. So in that schedule you have, pick a couple hours, an hour a week, a couple hours a month that you're going to reserve for these complete care patients. And that's where you do the examination. You kind of do it one at a time. And you know what? One success is going to breed more success. Right. And then instead of once or twice a month, it's going to be 3 or 4 times a month. And then what you're going to find is you're going to have, we kind of refer to our patients a little bit as general patients, which is that I'll say usual, customary, reasonable, the way we were taught in dental school or the way I was taught in dental school. And then the specialty patient, which is the ones that have to go through that process. And so as you identify those specialty patients and concentrate on the ones that want you to change, and want to get treated, success breeds success. And you'll find out that you're going to then start doing more of that. Mm-hmm. You're going to notice that spending more time with that, you don't have to do the aerobic dentistry as much. Right. You're going to notice, and again, it's not all about profit, but hey, profit is important. You're going to become more profitable. You're going to become 5 times as profitable when you have a couple of those patients as if you are seeing 50 patients that day, because those are all little procedures where you're just sticking your finger in the dike trying to stop the dam from breaking.
Right.
And that's what's going to really start to change things. So I think it literally is just that simple commitment. And then obviously you got to get the skills. I mean, we've talked generally here generically about the exam and the processes, and there are, you got to learn how to do that. Mm-hmm. But I don't think any of that is unteachable.
Right.
Our doctors that go through it, we have a very high success rate. I mean, it's, again, this isn't rocket science. I think it's just information delivered in a different way that makes sense. And I think probably one of the keys to this whole thing goes back to the exam. Yeah. If you don't do the exam, you don't know what you're doing. Mm-hmm. And so, we talk about a couple key things you need at the end of the exam. So, one, obviously you have to do it. So you got to find time in your schedule to do the examination. Right. But at the end of the exam, you got to do a couple things. Number one is, what did the exam tell you? And at the end, so what's all the information mean? Secondly, what's the joint health? Because again, we start our analysis and function at the joint. And then, you know what? Here's the good thing. The majority of the time, patients' joints are healthy, which is okay. We can move on. But sometimes they're not. And the absolute wrong thing to do is to do a lot of irreversible dentistry on somebody with an unstable situation. So we don't want you to get in that scenario. So you got to figure out what that is. And then the next thing is very general, is at the end of this exam, when I've looked at this information, is this patient a general patient or a specialty patient? And what we mean by that, again, is you've done the whole exam, and you know what? Everything's okay. You know, they're not tearing up their teeth. You know, they're not having functional issues. And it doesn't mean, though, that their function is perfect. It just means that for them, they don't have the habits making things get worse. It's very, it doesn't sound that important, but it is. You know, so this isn't about trying to eliminate every patient in the world that has an MICR slide. Right. But on the flip side of it is if you see somebody separate from the bacteria side of things, if you see somebody, though, that the teeth are wearing, they're breaking down, wear, mobility, migration, recession, abfraction, sensitivity, all signs of things that can happen to teeth separate from the bacterial stuff, you know, or teeth, you know, again, teeth are wearing out, the smile's affected, muscle, joint, or tooth problems. Those are the ones then that we take through this process. So that simple thing, is it a general patient, specialty patient, what's the health of my joint? And then having the conversation with the patient is, here's what I see. We've talked about signs and implications. And if you want me to solve your problems, here's what it would be. I'm here to help. Yeah. And again, one of those things that you heard Pete as well as I say, which I loved, is I am your advocate for health. Yeah. So what I like is we're doing this together. And what a much better way to practice dentistry when your patient comes in and, you know what, I'm here to help you. We're all on the same page. Right. Dentistry can be hard. And if you're doing dentistry on somebody that doesn't want you to do it, or maybe doesn't trust that this is the right thing, I mean, that can just be a bad day, you know, and we don't want those for you.
No, we don't. We don't. Now, this question came up. Deepak asked this question. It's a great one. And it does come up a lot is, do you recommend the hygienist see the patient first or the doctor? And so
that's a great question. And I'm going to say, I'll talk black and white, but I realize that the world is gray. And here's what I mean by that. Again, you got to figure out how you want it to happen. So for me, once I decided change, any new patient that calls our office, and my receptionist, Pat, she has a script she goes through, and she simply says, you know, welcome to our office, et cetera, happy to see you. Dr. Cobb likes to see you first since he's never met before, and he likes to do a thorough examination, and then you'll see the hygienist. Almost never, if it's explained that simply, does somebody say, no, I don't want to do that. But patients are used to calling and saying they need a cleaning. They don't call in and say I need a complete examination because I'm worried about some wear on my second molar. You know, they don't call with that. So if you have a practice that's used to, or maybe it's a high volume practice, and you're used to coming in and they see hygiene, I'm going to say that's fine. You know, but in your 5-minute hygiene check, if you've got to look quickly, and if you see somebody that has functional issues, you got to pull them out and do the exam. Or before you would do extensive dentistry on them, do the exam. You know, so my line in the sand for me was, I think it's my ethical responsibility to do a thorough examination on everybody that comes into my practice. Yeah. So, and certainly before I would do extensive irreversible dentistry. Because one of the other things we talk about here, Kirk, is that, you know, whatever we do for our patients, and complete dentistry doesn't mean, you know, 32 restorations. Right. You know, it's not that. It's about identifying the problems and solving them with the least amount of dentistry, not the most amount of dentistry. And so it's my responsibility to, you know, to get there. But the only way I can tell is if I do an examination on them first. Right. So whether I see them first, they come from hygiene and we do the exam, you figure out what works in your practice best.
Right. And what you're talking about is creating a repeatable standard in which you really, so they can come in from multiple, but they've got to go through this one important gate if we're going to go any further and do complex restorative or any restorative for what you call the specialty patient. Exactly. Now, what about for your general patients? Can I ask you about that? If a new patient comes in and same thing applies, how do you look at the process with a general patient? Are you still going to eventually go to a comprehensive exam, or is that going to still be a little bit more selective further down the line?
And again, great question. So here's the deal. I don't know. To me, here's the important thing. I don't know if you're a specialty or general patient until I do an examination.
Right. Okay.
So again, sometimes it's really obvious. People come in, their teeth are all worn out, missing, broken, whatever it is. It's obvious.
Right.
And so it's obvious too that unfortunately those people probably need a lot more dentistry to solve their problems. But what if you took that patient and you moved them in the timeline 15 years? Mm-hmm. What if we could fix some of the things that caused that to happen, and we could solve those problems with a lot less dentistry? Right. The only way, so it's not so obvious. So the only way I can tell is to do an exam. So I still do a thorough exam on those. And at the end of it, if my checklists are healthy joints, general patient, I don't go through the rest of the processes. I don't take the models. I don't need all that sort of stuff. But what I do know for me ethically is that now I can just roll them back into hygiene. And even if they need a couple restorations here, maybe something breaks or there's a couple restorations, I'm okay. Even if there's an MI-CR discrepancy, I can still treat an MI or whatever their habitual occlusion is. Does that make sense?
That makes perfect sense.
Yeah, but the only way you know is to do an exam.
Right. Now, you might think this is a silly question, but I do get this question, so I'm going to throw it at you. Okay, let's say, Drew, I'm creating this practice, and let's say it's a patient of mine for a long time or a new one. Are you charging for this exam? Let's say you notice some changes. You're going through the DOS Academy. You're getting this training. Are you going to charge this patient for an exam? Because that's a considerable amount of time for you, right?
I'm going to charge. I mean, I think you have to. Listen, there's only so many hours in the day that we can produce, right?
Right.
And I think dentists give a lot of stuff away as it is. Yeah. I mean, go to a physician and you get little bills for friggin' everything, right?
Right.
So I think you should charge for your time. Now, I will say this. I would say don't make that exam, which I think could cost hundreds of dollars for what you're doing, especially if you get the records and stuff. But don't do that then, because you can pick it up later. Meaning, so make it a reasonable fee. How much do you need to produce if you're going to do an hour here? So whatever it is, a reasonable fee. Don't make it too expensive. So I think it's okay to kind of lose on the exam a little bit, because if that patient ends up being a specialty patient that you treat, you're going to far outweigh a little bit you might lose on the exam. But don't give it away for free.
Yeah, absolutely. Thank you very much, because I completely agree.
Yeah.
I don't know that you could ever charge enough for your time in that respect, but you also don't want to make it cost prohibitive. So
exactly.
Absolutely. Now, just one, I have so many questions I could talk. This is my favorite subject, by the way, so I could talk to you forever. And any pitfalls that you would warn? I mean, you've seen a lot of dentists. You've gone through the heartache yourself. What other pitfalls should we be aware of when they happen in creating a balanced practice, balanced life? Is there anything that you'd say this stands out?
And, honestly, I think one of the biggest pitfalls is just we get in our way.
Right.
I think a lot of it comes back to the dentist, and maybe we're not trained to do so, but there's a lot of hats a dentist wears. Obviously we're trying to be the best clinicians we can. We've got to manage a staff. We've got to manage a business. I mean, I didn't have any business training when I got out of dental school, but you're training a business that could be a $1 million plus business, right? There's a lot of responsibilities that come to that. So I think the biggest thing, honestly, again, and I'm repeating myself, but I do believe it, is you just have to figure out what it is you want and how you're going to go about doing it. Mm-hmm. And then with your pitfalls, you got to get your staff on board.
Yeah.
Because the reality of it, one of the things we'll see with a lot of the younger doctors, or all the doctors really, is once we start the next step, identifying the specialty patients, and then we're going to go through the records process. And the records process simply is CR face-bow mounted models on articulator and a series of photographs, 21 photographs. And that's the information we need. If we have that, the exam and those two things, now we can go through our treatment planning protocols, 2-dimensional and 3-dimensional. We can go through our treatment planning protocols. But that, if the doctor's doing, and they think they have to do it, because one of the things we don't relegate that well sometimes. So we're going to do the whole thing. Well, now that great balance thing that I just talked about to you, you're going to think I'm nuts because you're going to be in your office till 7 o'clock. You're going to think, Drew's crazy.
Mm-hmm.
So your staff has to do it. So if you, all that stuff I just said, the only thing the doctor has to do in that, what I call an occlusal analysis, which are the models and the photos, is take the CR record. That's the only thing you're responsible. Your staff can do everything else. The face bow, the impressions, pour it up, mount it, get the photos, get everything together so that the next time you do that case is in the treatment planning process, which I love. And the treatment planning process is when there's no one else in your office, you sit down and your staff has that together. Models beautifully mounted on an articulator, not with stone all over the place or anything else. You know, the photographs. And then you can sit down and going through the protocols. I mean, I love this because this is like putting a puzzle back together. What's wrong? How do we fix it? How do we fix it with the least amount of dentistry to solve the patient's problems? And then you develop the treatment plan for the patient. And that's just fantastic.
Yeah. What's so cool about this, as I listen you describe the process, think about the benefit for the team, to be emotionally and intellectually engaged other than just tasking in a dental practice. They're involved. They're restorative partners.
Yeah, absolutely. Well, the other thing, and Pete had said this years ago, treat your staff.
Yeah.
So early on when you're learning this process, so the doctor said, what's one of the things we can do when we get back to our office? Do this whole thing on your staff. Right. Practice, do your complete examination, get the models, get everything. And so when you actually do it on the patient, make it like you've done it before. I love this. I'm a Redskin fan, which kills me. Say no more. It's been a long drought since we've been decent and everything else. But in the heyday, John Riggins, running back, Hall of Famer Riggins. I love Riggo. He was just the best.
He's awesome.
So there's this one year though that he was leading the league in touchdowns scored. But if you looked at him or you go back and watch the old highlights and stuff, Riggo would get in the end zone and he would just flip the ball to the ref. No dancing, no slamming the ball, no nothing. So I asked him one time, I said, Riggo, how come no celebration when you get there? And he said, for me, he said, I don't want it to look like it's the first time I've been in the end zone or the last time I'm going to be here.
I love that. I love that. And he went there a lot.
He went there a lot. And so when we start doing this on the patient, we got to make it like we've been and we've done this before. Right. We know how to do the examination. We know how to do the record. So practicing on your staff is just going to help you so that when a patient's there, you're not fumbling around for stuff. You're not asking your assistant for this or that. Everything's out. My staff tells me, though, you've got the patience of a gnat. Like if something's not right there, they're going to hear about it at the afternoon or morning huddle.
Right.
So I like things to go like clockwork as much as you can. Nothing's ever perfect, but I think that helps. The second thing, if I get to it, is when you actually then do the treatment planning and treat your staff. Right. Patients, I get patients that come in all the time and say, I want to look like that. And then my staff member gets to tell their story. One of my staff members, when she first came to me, she'd been in adult ortho for 5 years. Right. And again, it's that starting a process before you know where the end is supposed to be. So again, our treatment planning process that I like, before we do anything irreversible, before you pick up a handpiece, before you prep something, before you get something you can't walk away with, we need to visualize and work out what the end result is going to be, because then you know what you're going to do. It's like going on a trip without a map. Right. And we're just going to drive all over the place. It's like, old school for you and I. You go to the AAA and they would give you your trip map and they would draw the whole thing out. And that's what we're trying to do with our treatment planning before we start doing something. And so your staff members that have been through that, just reinforce that with the patients. They get it.
Yeah, they get it. They can build value for it. And the other thing is, I found this, they also have the empathy, because the burr sounds a lot different when you're in a chair than it is next to the chair, right?
It does. My dad one of the things my dad used to, and there's so many things that always fly through my head that my dad used to, he was a tough instructor. Everybody remembered him, but hopefully in a good way, was, and I always think about this, is that think about the trust that our patients have in us to let us do what we're doing. And I try not to forget that every day. And I remember after I'd gone through these courses and I'm doing my first kind of multi-unit anterior thing. And my patient is laid back. They came in and they're there, and I'm, you're jacking them up with anesthetic, and they're numb and they're trusting. She's lying back, and I prepped her 8 anterior teeth, and I'm thinking one to myself, I better know how to get this thing back together. I'm in a world of trouble. Yeah. And how amazing, though, that this woman who I've met a few times is trusting me to do this. Mm-hmm. And so, again, I think it's one of the huge things that I love is where the predictability comes in. Like, I know now if I follow my processes that woman who's trusting me, I know I can make her fabulous prototypes. We don't like the word temporary or provisional. Prototypes, because they're made with that end in mind. So they're made so we can solve the functional and the aesthetic issues. I know I can make them look great. And now I know if I can make them great, that I can predictably repeat that with my definitive restorations. Right. And that's comfort for us as the dentist. But again, I just can never forget the amount of trust that our patients put in us. And I don't want to break that trust. Absolutely. And, bad day for a dentist, Kirk, is Monday morning when you come in and you get the phone call and something's broken. Right. And I know we're all working as hard as we can. And if it's something that broke that we didn't do that long ago, it's just a really bad day. Right. And on your side as the consultant, how much does it cost a practice to redo something? Mm. It's not just the cost of what that crown was. It's an exponential number because you've got time out of your schedule again where you can't produce there. You've got however you're going to work it out with your lab if you have to repay it. Right. Is patient upset? I mean, that's, hey, and now with all this social media, what's a patient that's not happy do? Right. They're going to take to whatever their medium of choice is. Right. When we talk about costs, we don't have a line item for stomach lining, so probably should. And that's the stress. That's where you're not sleeping. And I mean, it's just this. If nothing else, I can sleep soundly at night. Yeah. Well, and this is what that's all about, buddy. And you use the word so well and eloquently, which is predictability, which is the Dawson Academy. Is just, I've learned that through you guys so much that is the element of true happiness is just when you predictably can create what you want. It gives you that confidence. And 7 to 2, 4 days a week, man, I've been teaching 7 to 3. I got to come out there and see how you do it. So if you're watching this, there are people all over the country that do this. And Drew is an amazing human being, great teacher. And we're only scratching the surface with you. I mean, you're unbelievable with the treatment planning process, the TMD. Now, you've got a webinar coming up on Tuesday, May 17th, and it's on the profitable treatment planning. Can you just tell us about what that is? There's a link in there. What will they see on this? We're doing it's more for people who just want to know more about it. So I'm going to get into a little bit more detail of actually what we do at the exam. I mean, it's a webinar. I can't do anything, but I'll get a little bit more detail on what we do at the exam, what the 2D and the 3D looks like, but then also just take you through a patient. Awesome. So this gentleman walked in, here's the deal. And the case that I picked is it's not anterior restorations, because almost everything you see out there is always anterior restoration. Right. So I kind of wanted to make the point that not everybody needs their 6 front teeth restored. So it's kind of a combination interdisciplinary teeth where in the end, the restorative procedures is mostly posterior. So, but again, it just reinforces the process, maybe another layer on what you and I talked about today. Yeah, so you don't miss that. There's a link right there. Click, register. And then also, Drew, if people want to get a hold of you and ask you questions, how can we get a hold of you? Through the Dawson Academy. They certainly have everything there. And, sign up for some courses, move forward. If you have any questions, they can certainly get us in contact. Happy to help any way we can. Dentistry is a great profession. I want it to be a hobby for everybody. Amen, buddy. And you have got the greatest hobby and the greatest life together. So I'm going to have you back on the TMD and all the other things. And I can't wait. So, buddy, I am just crazy, crazy grateful to get you for this amount of time and for you to carve out some time. So check it out at the Dawson Academy. You look for more from Drew. And if you ever get a chance to see Drew, don't hesitate. He is awesome. So stay on here for a second, Drew. I want to talk to you about a bunch of other things. So thanks for having me. Yeah, absolutely, buddy. So if you're watching, thank you guys so much for watching. We're so crazy grateful. If you enjoyed this, do me a favor, hit the share button and share it with your friends. We'd obviously love for you to spread the word and keep giving us suggestions on things that you want to see, and we'll do our best to get them to you. And until we see you next time, keep watching the Best Practices Show. You guys have a great day.